Good morning. Thank you all for joining us. It's been a really wonderful few days, and we're really looking forward to the remainder of the forum. And it is just tremendous to have all of you here and participating. We have a special treat this morning, and I think it's important to kind of take a pause here and just recognize how lucky we've been over these last few days with the folks who've shared their thinking with us and who really play a major role. But I would argue that the magnitude of the responsibilities on the shoulders of our special guest that's here with us this morning is truly staggering. As administrator of the Centers for Medicare and Medicaid Services, Seema Verma oversees healthcare programs for over 130 million of our fellow citizens. Put in another perspective, she also manages one of the 10 largest budgets on the face of the earth. It is without question one of the most important, challenging, and difficult positions in the federal government. But there's no argument that Administrator Verma is well prepared for the challenge. She tackles it with enthusiasm and a sense of purpose. She shared her commitment to modernize and strengthen the Medicare and Medicaid programs and to continue the transition to value-based health care. Recently, she unveiled new CMS initiatives to give patients greater access and control of their own health information, something so important to the discussions we have here on AI. And I want to applaud her for her willingness to listen to providers on a range of issues, from aligning quality measures to regulatory burdens to the needs of rural hospitals. Even before the president appointed her to lead the agency, she was a nationally recognized leader in health policy and was instrumental in designing the Healthy Indiana Plan, which injected an unprecedented degree of consumerism and patient engagement into a Medicaid program and serves as a national model. A graduate of University of Maryland and Johns Hopkins, and formerly the CEO of SVC Inc., a national policy consulting firm, we are very pleased that she could join us today. Please welcome Administrator Verma.
Thank you. Thank you, Gregg.
Thank you so much for being here. I think to kind of put it in the broadest context here, I just ask you, your agency, CMS, is the single largest payer of healthcare in the United States. How does that scope empower you as its administrator to influence the future course of healthcare delivery nationwide? And what are the most effective levers you have at your disposal to bring about that change?
That's a great question, but I think you framed it well. It is 130 million people. We have the Medicare program, Medicaid program, as well as our insurance exchanges. And we also set the quality and safety standards for many of the healthcare providers across the nation. And so we have what we'd say, we have the big hammer. And we're very cognizant of a couple things. One, we want to make sure, our top priority is making sure that the people that we serve get access to high quality care. We want to make sure that they have everything that they need. So that's one major priority. But the second piece is because of the footprint that we lead, that CMS has, we do have incredible influence over the entire healthcare industry. And so we're very cognizant that the moves we make and the things that we do really influence the entire marketplace. If it's not happening at CMS and it's not happening through Medicaid and Medicare, it's probably not going to be happening nationwide. So if there are need initiatives that are going on, they may be happening in one community in one particular area or in a healthcare system, but really until it comes to CMS, we don't really have national adoption. So we're very cognizant of that, and we are trying to move the healthcare delivery system in a different direction. There's been a lot of discussion about moving to value, and that's something that we're very focused on. We all know the perils of our healthcare system. I think the major one, or the thing that keeps me up at night, is how much money we're spending on the entire healthcare system. I think we have some recent reports that show that, despite all of the changes that we've had over the past 10 years, whether it's been new laws, regulations, we're still on target to spending $1 in $5 on our healthcare services, almost 20% of the GDP. And that is just simply not sustainable. If we think about that from a high level, for the government, that means that those are dollars diverted away from education, from infrastructure to defense. And at a very individual level, that means all of us are spending more on our healthcare. And I think we've all felt that. No matter where you sit, you're either spending more money on your premiums, or when you're going to the doctor, your out-of-pocket expenses, everything's gone up. And so we're all feeling that. So we've got a tremendous mission, not only to deliver high quality healthcare. There's so much technology and innovation that's going on in the healthcare market in terms of new therapies that are coming out, new technology, robotic surgeries. We're hearing about some great new therapies that are coming out, precision medicine, that are treatments that are focused on a person's exact genetic profile. So you've got all of this innovation coming out, and we want to make sure that patients have that. But then you have the challenge of how do we pay for it? So at CMS, we're addressing it on a couple of, I would say, main areas. We are pushing towards value, and that's our main thrust, is we need to move away from a system that's paying for volume towards one that's paying for value. And I think value means different things to different people. We focus it more on outcomes, and so there's probably 3 different ways that we're moving towards value. The first one is modernizing the program. If we look at our payment systems, how we're paying for different therapies, even in the area of drug pricing, I think we need to think about how we're doing things, trying to modernize the program. The other area is the consumer empowerment piece, is that, over the past so many years, we haven't been able to bend that cost growth curve. And I always think, where's the patient in this discussion, right? We've regulated absolutely everybody, passed these laws. Where is the patient? When we are, we've all had the experience of going to a provider and not having information in terms of cost and quality. You're sort of flying blind when you go to the doctor or dealing with the healthcare system. You don't always have that information that you need. And so we want to make sure that as we move forward, as we're moving towards value, the patient has to be in the center of that. They need to be making decisions for them and their family, and they need to have that information. So we're trying to do whatever we can to empower patients. So even just yesterday, we made an announcement around price transparency. For the first time, we're requiring hospitals to post information about what their charges are online. And that's just the beginning. We also want to start collecting information on what ideas people have to promote price transparency. So that's a major area of focus for us as well. The other area is the efficiency of our healthcare system. We're spending more than any other country on administration. I think I read an article just yesterday. It's about 8%. Some folks say it's up to 30% of our dollars are spent on administration. And what we want to focus on is providers providing high quality care to patients. But as we all know, there's a lot that's going on behind the scenes, and we need to really think about the efficiency of the healthcare system. And this is where I think this is an important area of where technology can really help us to help drive better coordination in the system, drive efficiency, so we can have doctors spending time with their patients and not having to worry about the burden in the healthcare system. So we're taking a lot of measures. We've had an initiative that we call Patients Over Paperwork, which is really designed to address some of the inefficiencies in the healthcare system and the burden that providers have.
That's a terrific set of initiatives, and I think as a primary care provider, Patients Over Paperwork is something I think we can all really get behind. You spoke about the large footprint of CMS, the huge footprint of CMS, and perhaps more than any of your predecessors, you're broadening CMS's footprint in the whole world of health data. And you've been critical sometimes of the current state of healthcare data and its dissemination between providers and patients, and even where electronic health records are involved. Can you expand on that? Tell us a little bit more.
Sure. So everything that we do at CMS, I'm a very data-driven decision making, right? We want to have the information. We shouldn't be flying blind, and we're in an era where we have so much data that's available to us. If you look at what's happened over the past 10 years, we've now moved to a system that is largely electronic. We have data that's now digital. You've got, almost 90% of providers have adopted electronic health records. And at the same time, you've got all types of new devices and innovation that's collecting healthcare data, whether it's a Fitbit or, monitoring devices. There's all sorts of data that's been out there. But the issue has been that data exists, we now have it, but it's been relatively siloed, and it hasn't always been available. I think it's going to be a year ago this week that the polio vaccine, I think they'd started some clinical trials, and I was reflecting on that if you think about what it took for them to bring large-scale use of this vaccine. They were sitting there in clinical trials, and all of that was done in a paper system, right? And if you think about how long it took for new therapies and innovation in those days to be able to bring that to the forefront, it took a long time because it was all manual. And now we're sitting in an era where all of that information is digital, and we should be able to harness that information. We should be able to do more with that. I always tell this story, it's getting old, but I think it sort of sums it up in terms of kind of the patient experience when it comes to data. I was traveling with my husband, and long story short, he collapsed in the airport, and because we were traveling, he was treated locally. And it was a very scary situation. We were in the hospital for a week, and when we left, it just turned out he was fine, but it was a life-threatening situation. It took them a long time to figure out what was going on, so we had all these tests that were done, a lot of monitoring going on. There was a lot of healthcare data that was collected on him during that period. And when we left, I said to the doctors, can I get a copy of his records? And I'm expecting, a little thumb drive or something like that. And they kind of looked around, and they're like, not really sure what to do here. Long story short, they came back to me with 5 sheets of paper and a CD-ROM. And I thought, here we are. The federal government has spent, over $30 billion, and I'm leaving the hospital with a CD-ROM and 5 sheets of paper. And when we were, it's not easy to find a computer these days that can take a CD-ROM.
Exactly.
But when we found one, it only had some of the tests. And so, it's sort of eye-opening about what's going on in the healthcare system. So we didn't have our data. And a lot of the information that was even in the machines that were monitoring them weren't necessarily hooked up to his electronic medical records. So even that information wasn't captured. So, I think we have a tremendous opportunity now where we've got all of this data being collected. I'd like to think about a future state of healthcare and medicine where, if we had, for my husband as a great example, if all of the information that his whole medical record from birth until now is all collected in one place. He now wears a Fitbit, but just imagine if all of that stuff was being collected, that we could have actually predicted what was going to happen to him. So, from my perspective, even as we're moving towards value, we want to make sure that the services that we're providing to people are appropriate, that they make sense. We don't have money or extra money in our healthcare system to be providing tests that people don't need. We don't have money to be providing for duplicate tests. We want to make sure that the treatment that we're getting is valid and that it's needed. And so a lot of the information that we have, imagine if our NIH researchers have access to all of that information, and what that might drive in terms of clinical treatments, and as well as just decision-making in healthcare to be able to understand all of that data.
That's a terrific vision for the future. And I think one of the things that we're excited about here is just, we've heard constantly how important data is to artificial intelligence and machine learning. And through your operations, CMS has accumulated what are incredibly vast amounts of data, mind-boggling. Mm-hmm. And they're going to get better. They're going to get better. How are you going to leverage that? What's your vision for really taking advantage of that?
Well, a couple of things that we want to do is we understand we don't want to keep it. First of all, data and privacy and security is very important. We want to make sure that our patients have access to their data, that they're making decisions about where that data is used and how it's used. Just last month, we announced our My Healthy Data initiative, and really what that was about was to make it clear to the healthcare industry that patients own their data, it's their information, they can take it, they can do what they want, and they had the ability to say where this data should go. So a couple of things that we've done at CMS around the My Healthy Data initiative. One of the things we've had available is something called Blue Button. And Blue Button's been around for a while, but this was basically a program that allowed people to get their claims data from CMS. But what they essentially got was an Excel file. There's no way that it was understandable. So data isn't anything unless people can actually use it and it's meaningful to folks. So what we've done with Blue Button 2.0 is now made that available in an API format. And so what we're hoping is that innovators, like hopefully some of you in the room, we'll come up with new apps and new tools so that that claims data can be taken by the patient, given to the app developer, and put into formats that help make sense to the patient. So it's organizing that data in a meaningful way. So that's one of the initiatives that we've had in terms of putting our data, or making sure our patients have access to their data. The second thing I think you're going to see us do is making more of the data that we have at CMS available to the community at large. Obviously, de-identify, that makes sure that we always have privacy and security the foremost of our minds. But you're going to see us do a lot more of that in terms of the Medicare data and also the Medicaid data. So over the next year, we'll be making some announcements about having that be more available.
That sounds terrific. With greater accessibility of all this personalized data, will this turbocharge medical research? I mean, I'm sure many people around the room here are hearing what you're saying and think, my goodness, this really could be a game changer for us.
I think we really are at that pivotal moment, right, where we've been collecting all of this data. The problem is the data has been siloed, and it's not all aggregated, and we need the ability to bring all of that information together for clinical research. If you think about all the innovation that we've had and all the exciting technology that's come to bear, the new treatments and new advancements, imagine how much stronger and more powerful that would be if we're able to evaluate, have all of that data at our fingertips. And that's not only at the research level, but even at the individual level. Imagine if you're able to aggregate all that information about the patient.
Yeah. One of the things that when we hear about having all that data, that we all stumble over is the whole notion of interoperability. And do you think that interoperability is something that we're going to realistically attain in the next 3 to 5 years?
Well, at CMS, I can tell you that we are determined to get there. We're going to use every lever that we can in the agency to drive towards that goal. We think it's absolutely essential, not only for patients, but for all the reasons that we just discussed. And I'll go over some of the things that we've already done. We started this initiative about a month ago, and just yesterday we announced a complete overhaul of the Meaningful Use program, so that program is very much focused on making sure that patients have their data, so that patients can give their data to researchers and give it to NIH, so that they have that available to them as well. So we've taken that. That's one of the things that we did yesterday. The other thing that we did was we're asking for comment on whether interoperability and the ability to give patients their data should be a requirement for participating in the Medicare program. We've also had it's starting out as a call to action. At some point, it's going to, we're looking at whether it should be required, which is the health insurance companies that we work with. We've got, within the Medicare Advantage program, we contract with many private insurers. Also in the Medicaid program with our Medicaid managed care plans. And then also on the insurance side, CMS has a lot of relationships with insurance companies. And we're sort of in call to action that just like we've done with Blue Button 2.0, where we've put the claims data in the hands of the patient, we're calling on insurers to do the same thing. And we're going to be re-examining all of our relationships with these plans to make sure that patients have their data. So we're really doubling down on this. One of the initiatives that we have is looking at the E&M codes, because we know that that's something that's influencing the ability and the ease of using electronic medical records. So we want to make that easier, and hopefully we'll have better adoption.
That sounds terrific. We've been learning a lot about artificial intelligence and machine learning here at the forum over the last few days. What are the ways that CMS is thinking about leveraging these tools?
I think as we talk about data isn't anything unless it's meaningful, right? And so I think we've seen the experience even with our initial Blue Button program is that you can have all this data, but if it's not in a meaningful format, it's useless. And so as we're collecting all of this information, if you can now go back to the example with my husband, you're collecting all this information in the medical record. You could be combining that information with devices. You could be combining it with monitoring or machines, all this vast amounts of data. You need artificial intelligence. We need tools to be able to analyze that data. So whether we're looking at taking data from remote monitoring to be able to identify what are the markers that require action, and then also just to be able to analyze that vast amount of information. I think healthcare has been a little bit behind when it comes to artificial intelligence, but I think the ability to bring that to healthcare and what that may bring. I think the possibilities are absolutely endless. So as I said at CMS, we feel like innovation is strong, gives us strong promise to move towards value and to help address some of the inefficiencies in the healthcare system.
That's incredibly exciting. Again, just unleashing the power of all the data that you have at your beck is going to really make a difference here. We've talked a lot about efforts that Medicare is making and CMS is making in many different areas. But we probably should address the elephant in the room, and that's the Affordable Care Act. What's your vision about how innovation can be used to address the challenges of the ACA?
I think the ACA covered 20 million individuals, but let's talk about what that coverage has meant. So if we look at in terms of the exchanges, in the exchanges, all across America, we've got folks going to these and being able to be subsidized and get private health care insurance. But what we've seen since the Affordable Care Act has started is that rates have gone up. The premiums have gone up by over 100%. So if you look at when the Affordable Care Act started, the rates have gone up tremendously. At the same time, because of the way the law is structured and some of the rules, carriers are fleeing the exchanges. And we have 1 in 10 counties in America that only has one carrier, one choice of carrier for that particular area, and that's also 10 states. That is very concerning when we're talking about value, we're talking about pricing, that those are virtual monopolies. And what do we think is going to happen to price when there's only one carrier in town? That means that providers are having to negotiate with one carrier. For patients, that means there's one network. There's not a lot of choices for them. So that's deeply concerning. And we know that some of the problems in the ACA, and there's a lot of finger pointing, but in terms of what's been going on, those double-digit rate increases and the 100%, that happened, up right before 2017, and kind of all the movement of carriers out of the exchanges. On the other hand, there's been a large expansion in the Medicaid program in terms of coverage there. The Medicaid program started 50 years ago, and that program was built for our most vulnerable citizens, our aged, our blind, disabled. And now we've put more people into that program, and that's a program that was already stressed. Across the nation, there's been waiting lists for disabled people, and instead of addressing those issues, we've actually put more people into the Medicaid program. And I'm not arguing that we shouldn't be covering people, but is the Medicaid program really the appropriate vehicle when we haven't even addressed some of the underlying issues that are affecting quality of care for the most vulnerable, disabled people? And instead, we've put more individuals into that program. The other thing is that program and its rules and how it's structured, it's built for disabled people. It's not built for able-bodied individuals. For able-bodied individuals, I think the needs, you want to encourage individuals to be independent, to not be depending on the government for their health care, and to build a pathway out of poverty. I'm not sure that the program's been built that way. So we're doing whatever we can to make that program more flexible. If that's where we are, then we want to make sure that program works better for the people that it's covering.
Are there any innovations that are coming out of the CMS Innovation Center that you're excited about?
We're super excited about our Innovation Center, and that's really our place too. When we talk about the drive to value, that's the place that we will be testing out a lot of innovation. So it's been started with under the leadership of Dr. Conaway, and I think he's going to be joining you in a little bit, and we miss him every day at CMS. We're very excited that we just named a new CMMI director, Adam Bowler. And so we've got some great leadership in that program. But what we're doing is we're taking a look at all of the models that have been in play. And I think a lot of the models that were there were focused on providers taking more risk, more accountability, focused on improving quality, and also focused on coordinating care. What we want to do is move these models in a slightly different direction. I think those models are working. We continue to be supportive of them. But thinking about the models also and on a couple of fronts. When we're driving towards value, again, the patient's been missing in that discussion. So we want to see these models figure out how to include the patient, how to empower the patient into that value discussion. So incentives are not only just for the providers, but is there a way to bring beneficiaries into that? We also want to make sure that we are driving towards, when we think about value, that value doesn't have to just be about providers taking risk. I think there's other ways to measure value. There may be providers in the healthcare system that aren't able to or not willing to take on risks. So are there ways that we can think about pushing towards value in terms of bonuses or incentives to have providers move in that direction? So we're taking a comprehensive look at all of the models, trying to reform them. And then I think as we move forward, there's going to be different models that we'll be looking at as well that have more of a consumer empowerment piece. The other part is just looking at competition in the marketplace. And I think that, historically CMS has been a price-setting agency. And I think we want to move to a realm where there's more competition, where, maybe providers are figuring out what the prices should be, not the government setting them. So those are some of the ways that we're looking at models. The other thing that we want to make sure of is that we're also making sure with the models that we're ensuring that we have a competitive marketplace, and we're very cognizant of some of the consolidation that's been taking place in the healthcare system. So we want to make sure that the models are not encouraging that, and that our patients always have choices.
Great, that's an ambitious agenda. That's terrific. Looking broadly at your prior as CMS administrator, I'd love to get back to something that you've mentioned, you've touched on a couple of times, but I'd love to just dig deeper in the last few minutes that we have. And that is just talking about patient empowerment. It really seems like that's something that's really core to what you're trying to work on at CMS. In your ideal world, what is that optimal relationship between providers and patients and CMS? How would all of that work? Because I think it's a very, very, very powerful notion.
I think we've all gone to the doctor's office, and we know, you're flying blind. You don't always know about who your doctor is, what type of, is this the right doctor? Should I be seeing this person? What are things going to cost? And as we're driving towards value and we're making all these decisions about what treatment should be available, patient has to be a part of that. They need to have the information and those tools available to them. With all of this data that we've been talking about in artificial intelligence, I mean, just imagine being able to, you need a specific treatment, to be able to look that treatment up and know which providers in your area do a great job at that, how much it's going to cost, and where you can get where you can get the best deal. The other thing I think we want to do when we talk about patient empowerment is making sure that the healthcare delivery system is focusing on letting providers be providers and letting them serve their patients. Right now, we have so much administrative burden getting in the way. And we're very much focused on our patients over paperwork initiative. And as we've gone across the nation and we've talked to providers, they've identified some of their main concerns. Some of their concerns are around the electronic medical records, that those were built for billing systems, that they're not necessarily helping them with providing good clinical care. One of the other areas that we've heard about is measurement and quality metrics. As we're driving towards value, obviously quality is extremely important, right? We want to know what we're getting, and we want to make sure that we can evaluate providers. But when we have 70, 80 quality measures for hospitals, and it just becomes overwhelming, and at some point it becomes meaningless. And so one of the initiatives that we have is called Meaningful Measures. And the idea is, it's not that we don't care about quality. We want to make sure we always stay focused on quality and safety. Those are paramount in the system. We've got to make sure that what we're measuring actually makes sense, that it is meaningful for the patient and for the provider. There's no point in collecting information on process information. We need to be focusing on outcomes. Did the patient get better? Did we meaningfully improve this patient's life, their care? And looking at it that way. So one of the things you'll see, we just, again, made an announcement yesterday around for hospitals, and you'll see that we pulled back a lot of the measures. What we found is a lot of the measurements are duplicative, they're process-oriented, they're topped out. And so over the course of the year, you're going to see us focusing on pulling back a lot of the measures that we feel like are unnecessary. And the idea is, the goal is to allow providers to remove a lot of that administrative burden that we think is driving up costs and actually pulling them away from focusing on their patients.
Thank you so much. I think we've had this extraordinary opportunity to hear a lot of what I think is music to people's ears here. We've heard about focusing on interoperability, on harnessing all the data and making it available so we can use it to get all the insights from the innovations that we're talking about here over the last few days. The whole notion of patients over paper, empowering patients, removing administrative burden, and really starting to focus on quality that really matters to our patients. That is an incredibly exciting agenda. Thank you for sharing it with us here this morning, and thank you for your service.
Thank you.
Administrator Verma.
Thank you.